Hello, my name is Dimitrios Mathios. I'm an assistant professor in neurosurgery at Washington University in St. Louis. And I'm honored to have received the Faculty Starter Grant in Translational Medicine from the PhRMA Foundation. The interest in science for me started very early on. I had a few role models. I remember back when I was growing and HIV was, in its peak, and people were trying to develop vaccines. I remember Anthony Fauci was, at the forefront of this research. I was very impressed with, the dedication to develop, something that, works for this, very difficult to treat and devastating disease. And, at that time, I knew I wanted to do medicine, and I knew that, I wanted to do research to develop something new for patients. The PhRMA Foundation award for my research has specifically to do with developing new technologies for non-invasive diagnosis and detection of brain tumors. Brain tumors is a devastating disease in general, and it affects the very, the core of our existence as human beings. It's been very challenging to identify brain tumors in the blood specifically. The reason for it is that there is a barrier between the tumor and the brain in general and the circulation, the bloodstream, preventing biomarkers and molecules exiting this microenvironment of the brain into the circulation. And so we're really talking about a needle in a haystack, very minute amounts of molecules that circulate in the bloodstream. And we have to have technologies that are really sensitive to pick those minute amounts up. So the goal of my lab is taking advantage of new genomic technologies to develop assays for detection of brain tumors earlier than currently. I think that if we were able to develop a very robust technology that can tell you whether you have brain cancer at any point, in your life, when you're going to your primary care doctor or when you have a routine checkup, that would really make a big difference in the quality and the quantity of life of these patients. I am 1 year out from starting my faculty position, and it is challenging to start, and especially as a surgeon scientist, it is challenging to get funding to convince people that not in the operating room all day and all night. In fact, I am interested in research and developing my own program. And so having this grant really enables me to get started with my lab, hiring a couple of people in order to help expand on the work and create preliminary data that I can use later on to apply for bigger grants. Obviously, I think everyone in academics would like to go up the ladder and become full professor or, chief of the division or whatnot. In terms of the research goal specifically, what I am interested in is the work that has been done already and we have preliminary data on, to try to move it on and really have a mechanism for developing incrementally, the appropriate populations to test these new technologies on, in order to actually have a product that will make it to clinic, to patient care.